Hey, Nation, back with Dennis Wilson, the man who roams around Southern California. Probably not roaming as much these days. How you doing, man? You keeping it safe?
Doing very well and keeping safe,
All
but
right, all
not
right.
doing any roaming.
Yeah, exactly. I'll tell you, I'm going crazy. I've worked remotely for years in my home office since our lease expired. I think it was 2014. But this is different. It's different when you're told you cannot roam around
Yeah.
versus running errands and whatnot. Hey, we're let's talk technology and healthcare. We haven't, speaking of the current situation, healthcare. What
Yeah.
are you hearing out there in terms of the technology, the spammers, the bad guys?
Well, originally, in the first part of this year, the beginning of the COVID era, many of the hacking groups had originally pledged not to take advantage of vaccine research and big pharma and all the big hospitals and taking a hands-off approach. But that seems to have gone by the wayside since November.
Okay,
Checkpoint Software just mentioned that attacks were up 45% just in the last 3 months, and
man.
that's going to be bad news. Uh, but they said that basically it's the public's fault again. That the CDC had said, hey, look, stay home for Christmas holidays,
Yeah.
and over 1 million people traveled
Oh, at
in
least.
the U.S. and it filled up the hospital. Certainly here in L.A., the
Yeah.
hospitals are absolutely crammed, and that is being too much for the hackers to ignore. That's yeah.
Yeah. Yeah, it's really something. Now, when you say hackers, let's double click down into that. Are they attacking the entities in the healthcare supply chain, or are they sending me a spam email and wanting me to click the link for some fraudster stuff?
Well, interesting because the detail on that was kind of interesting. It's nation states for the most part
Okay.
appear to be going after the big clinics, the big hospitals, but I'm not really sure at the smaller clinics, the smaller practices are getting phishing attacks first, or if they're getting some other kind. But certainly the nation states are going after the big boys.
Yeah. Yeah. Exactly. No, it's the topic of the day, and as we come into 2021 and some new approaches coming out of DC and the vaccine
Yeah,
trickling
yeah,
out,
it's
I don't know.
trickling.
Yeah, it's a interesting supply chain conversation. That's a whole nother podcast. But the well, I'll tell you what, keep your eye on the ball with this, and let's revisit this in a couple of months, right? Because we should start to see, I hope, uh, that I'll be eligible for the vaccine maybe in April or May. I'm pretty far down the list, to be quite honest.
Yeah,
But
but you know,
I'd like to
Southern California now
go
has
ahead.
the 65 pluses on as next one in line, and LA County has made 65 plus available for anyone who can get an appointment, but nobody can get an appointment.
Yeah, that's what I've heard. Yeah, that's what I've heard. It's a little bit of a supply chain bottleneck.
Yeah,
All right, my friend. Well, I'm glad you surfaced this topic. Very timely. Thank you for being one of our analysts. And we'll talk to you next month. And I think we have next month. I'm excited about the uh, LinkedIn Social Index.
good.
You're big on
I'll look
LinkedIn.
forward to it.
All right. Thank you. Thanks, Dennis. Thanks, Jenny.